A community on high alert, but a community also coming together, working with law enforcement that yielded an arrest of this gunman who went on a deadly shooting spree, killing 3 people and injuring a 4th person in Detroit over the weekend, apparently targeting people at random. Now, we don't normally cover violent crime on a daily here at Michigan Chronicle, but we thought it was key to talk with a behavioral health expert, one who could yield information but also perspective. Because while police say this gunman didn't have a criminal record, they do believe perhaps there was a mental health issue.
Look, I tell you, we've done an incredible job in training our law enforcement partners through CIT training. This is crisis intervention training that we offer to all of our law enforcement partners. We do the same in terms of mental health first aid that we also offer to our law enforcement partners and to our families as well. When these shootings occur in our communities, it should affect all of us, because for one thing, we first need to look at gun violence within itself. How are folks getting access to these guns? First of all, let's start there. Are there some things that we can put in place, not only as a law enforcement community, but also as our legislators and other stakeholders, to put things in place to keep guns out of the hands of folks who should not have them? But I also want us to note that crimes happen every day within our community, and it's unfortunate that they do. But instead of trying to pinpoint to a certain extent someone who has a behavioral health challenge being the one who committed these crimes, let's see whether we can provide services to folks within our communities. Let's start there first. Let's let folks be aware of the services that we offer. If you have a loved one who's going through some challenges, Detroit Wayne is here to help you. You are not in this by yourself. If you have a loved one who you've done everything you feel you can, whether it's taking them to the hospital, you've called the police, and the resources that have been offered there just isn't enough. We here at Detroit Wayne, we are here to help. And that's what I want folks to know, that just as how we have, within our communities, urgent care centers, we need to have, crisis centers within our communities, because people want to know where can they turn when they have a loved one or someone who they know is struggling with mental health challenges.